Hello, I'm Kay Hyman, Chief Executive, Nepean Blue Mountains Local Health District. Our vision, encapsulated in our tagline, Together Achieving Better Health, and our values underpin our health service delivery. Every day, our staff and volunteers demonstrate these values, and we recently introduced our Reward and Recognition program to acknowledge staff and to complement our quality awards. In 2012-13, the district improved performance in both emergency and elective surgery and emergency department key performance indicators. Our community has benefited from upgrades to Penrith and St Mary's Community Health Centres and the Nepean Oral Health Centre, which is the third largest in the state, has reduced waiting times for oral health care.
We done about 140% more activity compared to the previous year. We reduce our waiting list substantially. Before waiting list used to grow, this is the first time actually we had a reduction in the waiting list, and it's a substantial reduction, 30%.
Achieved 82.5% hand hygiene compliance. That's opposed to the national benchmark, which is 70, and the New South Wales average is 79.6, and the national average was 76.9. So that's fabulous, fantastic news for the district.
The volunteers have made a great contribution to Nepean Hospital in the last year. They've raised an enormous amount of money for Nepean Hospital, and not only that, they provide a fantastic contribution to the life of Nepean Hospital. Their guiding program around Nepean Hospital, they have a squad of people in almost every department. They're integral to the daily life of Nepean Hospital. We can't do without them. A lot of teams across Nepean Hospital have worked to improve our national emergency access targets, so we're admitting patients more quickly, more safely across the whole hospital.
The problem that we had at Nepean Hospital in regard to our E24 patients, which is one of our emergency category patients, is that in the initial phase we did not have the capacity to deal with those patients. In March 2012 we were lucky enough to open our East Block extension to the operating suite. We were able to open 6 additional operating rooms, and we have a 26-bed recovery unit now, and that gave us additional capacity to manage both our elective and our emergency workload. We still felt that there were other things that we could do to enhance the patient's surgical journey, those emergency patients. Things around looking at our emergency booking process and how we might streamline that and make that better. We're working with the IT department to manage that electronically.
In October last year we opened the Centre for Robotic Surgery at Nepean Hospital, and Professor Mohammed Kadra is leading that process.
Nepean Hospital is delighted to have received about a year ago the Da Vinci Si3 robot. Since then, 75 patients in this public hospital, Nepean Hospital, have received life-saving surgery through the Da Vinci robot. We have been appointed the first centre outside of North America for surgical research into robotic surgery by Intuitive. The advantage of the Si3 robot, the Da Vinci robot, is that it allows major surgery to be done through keyhole techniques.
Primary care and community health service staff do great work caring for patients in their homes and in community settings.
One of the programs is the Strong Fathers, Strong Families program, and that's an Aboriginal specific program aimed at the significant males, particularly the fathers, within Aboriginal families.
One really good example, evidence-based example of a strategy that was used in Lithgow, and it was aired on local radio, Think Consequences, and that was targeting parents around underage drinking.
By supplying my 15-year-old daughter with alcohol, I accept full responsibility for the consequences.
The evaluations indicated that 40% of people that were surveyed had heard the campaign up to 10 times, and that 85% of the people surveyed could recall the health message. So that was a fantastic outcome.
So the Lithgow Ambulatory Chemotherapy Service is an outreach service from Nepean Cancer Care. Establishing it here has meant that there's 500 patients that have been able to have their service here instead of having to drive to Nepean. The Therapy Assistant project was in partnership with the Allied Health team. We looked at developing the skills of our therapy assistants so that they can provide some of the direct care at the lower complexity level, so the patients can receive care. It's always under the direction of one of the Allied Health, but it means that we just have a little bit more capacity to actually have people continue therapy if we have a shortcoming. So Lithgow has a really strong body of volunteers who work by providing coffee shop and other services through the day. And the outcome for the patients at Lithgow is all of the money they raise comes back into the hospital to buy equipment through the year.
Clinicians working in our facilities have made a number of groundbreaking research and program advances with significant positive implications for the health of our community. Most notably, Nepean Hospital's neonatal intensive care unit pioneered a world-class treatment using probiotics to prevent a deadly bowel condition in premature babies. The treatment has been introduced with a 100% success rate to date.
A simple and cheap formula is helping babies born prematurely battle a potentially fatal disease. Developed by a group of Sydney doctors, the treatment tackles a bowel condition before it even develops.
Doctors at Sydney's Nepean Hospital have been giving a special probiotic supplement to all babies at risk. Essentially, it's good bacteria, like those found in some yogurts, mixed with breast milk.
We had about 5.6% incidence of NEC from 144 preterm babies, which were matched to the characters what we have in the prospective group. And since last 1 year, we haven't seen a single case of NEC. So it's a huge reduction. And it's a huge benefit. I mean, if you look at the cost data about NEC, I mean, if one baby gets NEC, it's going to put a burden about $85,000 on the health system. Whereas we're talking about probiotics, I mean, the amount of money we have spent is something like $50 to $75 per baby. So it's a huge saving for a country like us.
And the Nepean Cancer Care Centre commenced an Australian-first combination radiotherapy treatment for lung and spinal cancers with positive results.
SABRE at Nepean is an Australian first because we are the first centre to use volumetric arc radiotherapy to treat SABRE patients. Patients have to come for treatment for less time. The treatment is potentially as good as something like surgery when patients aren't surgical candidates, and the treatment outcomes for patients are potentially much better than traditional treatment methods.
We looked at our patients presenting to our hospital, and we know that our Aboriginal population is presenting is quite low, and so we looked at ways of encouraging local Aboriginal people to present to the hospital. We formed a committee with our local Aboriginal population and other community members and our staff and looked at where the gaps are. One of our strategies has been to rename the maternity unit to Karana, which was its original name, which means bring forth the young. So both Blue Mountains and Springwood Hospital have massive support by our volunteer groups. We have an auxiliary at both hospitals and they both have raised substantial funds but also provide support in other ways. At Blue Mountains we have a hospital shop that the volunteers run and they've made in excess of $25,000 in the last year.
Our mental health building on the Nepean campus is nearly complete.
We've been able to focus more on our local community and our partnerships within the local community. We've introduced a few new services, a community assertive child and adolescent team, an assertive community treatment team, and we've strengthened the specialist mental health services for older people.
award that we won was the Minister for Mental Health Award for Excellence in Mental Health Provision. It's called the PEC Inspirations Project, which stands for Psychiatric Emergency Care Centre. And we then developed this project with consumers whereby they wrote their stories and they gifted them to us. We had them printed in this beautiful book, and we then used those stories to help other consumers that are despairing without hope to see that you can come out the other side. Such a small project has made such a huge impact. We're very surprised, not only in the consumers that read the book and say they feel touched by that and it has been very helpful, but by the impact on the staff, not realising what a huge impact they have had on the lives of others.
As you've seen, our volunteers play an integral role in our local health district. I'm incredibly proud of all that we have achieved in the 2012-13 year.